Buenas tardes, bienvenidas nuevamente. En esta oportunidad vamos a...
Good afternoon and welcome again. Now we will open the third panel, in this case about stigma and discrimination in times of pandemic. The presentation will be by Javier Orcade Belloc. He's a journalist and specialist in communication in crisis. He has an MBA in communication and over 30 years of experience as to response to HIV, hepatitis, and COVID. Discrimination, radicalization, equality, and equity in times of COVID pandemics. Jonathan Mann said 4 decades ago that discrimination related to HIV would kill more than AIDS. Unfortunately, he was not wrong. And in order to put an end with HIV 2030 as a threat to public health in UNAIDS, we have to put an end to inequality. Nothing easy at all. This has to do with the stigma fully related to HIV makes the AIDS to be so difficult to end from the social point of view. This is the axis of this symposium. This is the pillar of this symposium. We have seen this with Bruce's presentation on U equals U. Institutional discrimination, and the barriers to put an end. This has to do with the treatment and contention of key population as to the cascade of treatment, and they have to test those who are HIV negative. We see that inequality is a cross-sectional question. And in that regard, we are relating this with COVID-19. In Latin America and the Caribbean, AIDS epidemics is concentrated. So we are saying that this happens among key population of HIV. This is why 2020 and now 2021, key populations have been exposed to different forms of abuse of human rights, violence, etc. And I would like to quickly mention that under the excuse of the quarantine and lockout time management and circulation of people that was strongly seen in 2020, there was an abuse of human rights against people in key populations. There has been institutional violence under the excuse of reducing circulation in the hands of uniformed forces, lack of access to health for people with HIV, antiretrovirals were interrupted because hospitals became exclusive centers for COVID. And because of bad planification, trans people did not have any access to hormones, no access to comorbidities and treatment. And we will see the impact on HIV, but also other diseases because of health, non-transmittable diseases, the impact on cancer, diabetes, and other health issues, not to be able to have access or continue with access to the other services. And of course, this has had a very important social aspect. Many people have lost their job, but also some precarious jobs and sexual work has been pushed to clandestinity, and many sexual workers and trans people were forced to leave their homes, and they have suffered and still suffer a very important food crisis. They have been more exposed to COVID and HIV. It is important to understand that Latin America has, unfortunately, a very important role today. If we have a look at the accumulated cases of COVID positive, we have 20%, a significant amount, total population of the region. And a terrible thing is almost 1.5 million people have died, and this is not over yet. This means a global quota of 32%. The countries in Latin America that are at the top 10 of the most affected countries by the pandemic is Brazil, Peru, Paraguay, Colombia, and Argentina, together with other regions in the planet. Of course, what happens in Latin America and some islands on the Caribbean is there are 21 countries that still have a duplication rate that is quite high today, talking about COVID. More than 50% of the global cases in 2021 come from Latin America and the Caribbean. We see this chart in the previous information, and this chart, which is great, comes from UNAIDS. I want to thank Dr. Alejandro Colau from the Economic Unit that shared this with us. This is a good illustration. If we have a look at the rich, developed countries, this is the upper band. We see that the forecast and the different scenarios in the future have to do with the fact that by March 2022, the estimates say that they would be able to cover total vaccination in very high percentages, not 100% though, but this is related to put an end to the pandemics if not new versions like Delta keep on appearing. Now, if we have a look at poor countries that depend on COVAX, they manage the donation of vaccines, we can see that the necessary coverage of vaccine to control pandemics would come to our countries by January 2024. As you can see, this is 2 years difference, and this means inequality. We can see a big concern. We see how there's an inflection point as to global sanitary or health condition. Rich countries traditionally have contributed with resources as to fighting against AIDS to the poorer countries by means of different mechanisms like the World Fund, etc. There's an ambivalent case. Many rich countries have put a lot of money onto COVAX vaccines as well as other tools as ACTA for the vaccines. And this has given resources by the World Fund as to C19R initiative. And these accumulate vaccines. On the other hand, they discuss on boosters on vaccines when most of the African countries don't have more than 1 digit of the percentage of vaccines. And we also have countries in Latin America with very low vaccination rates. So we see that we have this feeling like the Titanic, only those who are in the first class will be saved, and those who are in the tourist class, the poor class, under the flotation, below the flotation line, are the ones who will be more prone to suffer from this crisis and die. The caritative, the investment known as bilateral, multilateral, the impact on the investment may be affected, this caritative investment, because rich countries had to put a lot of money in their borders, within their borders, to respond to crisis. So there is a change as to priorities in the global health. There's a trend that is the preparation for future pandemics and how to respond to the global safety. And this can have to do with AIDS. In a few months, the replenishment of funds for malaria will appear, and how we see global sanitary situation is for these 3 diseases. There's a very interesting concept in the South African philosophy that is Ubuntu. The idea is everyone for everyone. I exist because others exist. And there's some very negative symptoms related to COVID, where there's this philosophy of everyone for themselves. Since this is a pandemic, until not all the pandemics has been solved in most of the countries and most of the population, this will not be solved anywhere. This is some basic concept. And lastly, the emerging idea of mobility, the vaccination passports, restrictions of getting into countries or certain places if the person has not been vaccinated. This creates a new community of people who have this stigma, and they are discriminated. They are set aside because of the fact that they have not had access to a vaccine. They won't be able to perform certain activities or to travel. So not only are we the NGOs, those who work on international health, those who travel who get together and to work, but there's also some population who travel to countries with restrictions for the crops, for example, of certain products. This will have quite a negative secondary impact. Also, this puts us back on the situation, on the fact that HIV has been discussed for 30 years. This is access to the medicine, access to science, access to, well, this is threatened by intellectual property that is in the hands of a small number of pharmaceutical companies, and this affects the poorest countries, those countries having with quite poor policies, health policies. These countries don't have a present government, a present state that can control the abuse of the private sector. For example, compulsorily enabling or disabling a patent, for example. They penalize the problems of supply and compliance. Many countries are affected because the pharmaceutical companies are not providing the vaccines, but they also generate economic punishment to the companies that are not complying with their promise. Also, the importance that we see as to the fact that public health, it is important to have gratuity, the costs to have access to the services, in this case of COVID, AIDS, and HIV, are not should be catastrophic. And also, fair price with which countries buy PSR, viral load, different retrovirals, different tools. Also, the transparency of the fair allocation of resources. Also, those that are distributing all the tools among the poorest countries. So it is very important to think that we need to think about the generation of good or bad vaccines. We should not think about this, but the restriction of those who have been vaccinated with Sputnik, which does not have World Health Organization approval, considering the vaccines for rich countries, this generates different kinds of population. Those who received for vaccines that are good for the northern countries, and those countries that received vaccines that are not so good in their view. They're calling to urgently distribute more countries to poorer countries. This is their priority. Now, as to during the pandemics, we have suffered of a very poor health communication and sanitary crisis. This is one of the big lessons learned. And this is a responsibility to the formal communication that has generated panels, those who don't even know about COVID, virology, or molecular biology, or coronavirus. The pandemic has been involved or affected by politics, by political parties, and there's at least 10 countries in Latin America that are having a very important political institutional crisis, and this has to affected by the complications. Of course, the social networks, well, somehow they have not been able to cooperate, and we are going through quite an important infodemic together with fake news. And the role of the traditional media. There are some very persistent anti-vaccine movement, and this even involves anti-mask movements, anti-maskers. This is making a big damage, difficult to revert. Post-pandemic's narrative, some countries in the north are thinking what to do when the COVID is ending, and many countries are too far in the south thinking how to overcome the crisis. All this involved with the bad communication, anti-vaccine, infodemics, affects the acceptability of the vaccines. This is why we should insist on the fact that the most important aspect in this crisis is the vaccines. We should think that crisis will end before the real end comes, because we will make the wrong decisions. And if we cannot solve this, pandemics will not end. Just to end, I would like to think about some challenges. We have to vaccinate the rest of the world and see how we continue with those countries that have vaccinated a lot. Think about the health structures that have been affected by COVID, mitigate the impact, missed opportunities, dramatically improve communication, discuss the vaccination passports and the restrictions to travels, prioritize the social, economic, and mental health protection in the countries that were affected for 2 years with this COVID situation, and return protagonism to integral health. Just to put an end, people with HIV, they belong to the vulnerable population groups. We have to review this because there's no consensus. We have to prioritize the vaccination, and the access to HIV services should not be vulnerable, and we should not, people with HIV should not set aside their confidentiality. Some countries have an increase of 25% of lethal characteristics. Decision makers have to know that people with HIV die more of COVID than those with HIV. Vaccinating right now has to be the first priority. And just to put an end, we want to invite you to contribute to 2 initiatives in Spanish: COVID VIH and COVID and Key. And I want to thank Virology Education to invite us to reflect on this once again. Thank you.
Thank you very much for this excellent presentation. We have Marcela. She's been working on this for 30 years and has been very active for 5 years. She represents the people with HIV in Argentina, and for 10 years has been part of the Latin American and Caribbean movement, and she's part of the counseling. Also, Maria Lucila Esquivel. For those of you who know her, we know her as Lucy. She's founder and current president of Unidas en la Esperanza. This is an association of female sex workers in Paraguay, and she also forms part of the Retrosex, as she's responsible for information and training of the network. I'd like to open up the panel based on the presentation of Javier, asking you how these structural barriers that were evidenced during the COVID pandemic affected your communities in particular, and what your organizations did to respond to that. Marcela? Okay, okay, thank you. It's good to be here with everyone. Thank you very much for this invitation and to continue including this topic on the agenda. Undoubtedly, COVID showed a fragility in health that apparently were forgotten, including public health. It seemed that everything was resolved, and when COVID arrived, we saw a huge fragility. Undoubtedly, we responded rapidly for urgent problems, but it wasn't the same response for this on the part of the systems. One of the strongest points we saw, and undoubtedly I would like to mention, because apparently this is something very simple, but it is a serious issue, is that the disarticulation of the programs. When COVID hits the infectology system, people don't know where to go, what to do, and nobody was providing an answer. The strategies that we adopted as a civil society were a lot faster to see how we could deliver medication, what was happening. When one of the points was, how can we access treatment? What is happening socially, and how do we, because a lot of people were living alone, a lot of them had no way to respond to different situations that were arising. Over half the people, you know what they were asking for? Food. They weren't even asking for treatment. And this shows the social inequality in Latin America and the Caribbean. This inequality that apparently is invisible, they don't see it. And this discrimination when we're asking for food, we had to say, oh, if you lived with someone with HIV or you had HIV, you live with HIV or not. From the social civil society trying to set up a response with the programs. So I think COVID has been a great opportunity to see a hidden reality. This is what we have to show. We have to pull it apart so we can have, when we talk about comprehensive, I mean, out of my own voice, I think it doesn't exist. A lot of speeches, a lot of programs, a lot of things written, but when it comes down to brass tacks, this comprehensive service, it doesn't exist. People with cancer who didn't know where to go for therapy, programs that had to go do with a lot of things, they were disintegrated. And of course, the antiretroviral medication. Thank you, Marcela. Thank you. Thank you, Marcela. Lucy, what happened in Paraguay? What happened in your organization? Yes, first of all, thank you very much for the invitation. Good afternoon to all of you. I just want to mention that we are in a forum of stigma and discrimination, and my partners were not able to enter because they had problems with the access to the link. So I just want to clarify that. So my colleagues weren't able to access. The other thing is to mention that the pandemic clearly became, all the problems we were seeing as social workers became visible, as well as the absent state in the life of sexual workers. And the pandemic, stigma and discrimination, this is one of the worst pandemics of our lives, even way before HIV and COVID. Social assistance never arrived for our colleagues. Having to stay at home for sexual workers was a problem because, based on that, police was exerting a lot of force. We weren't able to work. And therefore, many of my colleagues today are homeless, and the only help that they received was through ourselves, through friend, allied organizations, and also the network that destined some funds to be able to purchase first necessity items, food, and with those things were the ones that we sent to our partners or friends, colleagues. But from the state, nothing, including masks, bleach, and other things that had to be used to put all this in order, the protocol that the government was implementing. So for us, this was really a learning curve and very major for the sexual workers, because the sex workers, because we could see how we could help our colleagues around America. The Retrosex Network moved, and as well in Paraguay, for this humanitarian aid. Thank you very much, Lucy. Javier has mentioned some challenges for the future and some actions that we have to think about. COVID has also dismantled our health systems and reduced budgets to respond to HIV and other health issues, to dedicate those to COVID. And some of our countries are still trying to see how this has been reduced. What actions would you propose? And this is a question for all three of you. Go ahead. What do we have to do to respond to HIV? Take this up again and eliminate stigma and discrimination towards the most affected communities. Marcel? The truth is, as a civil society, once again, we have to set everything up again. Can you hear? Probably because as a civil society, once again, we have to set up another response, and that as associations of civil society, we be the center to see how I think the states themselves are all dismantled, and this stigma and discrimination is growing more and more in the different communities. And COVID came to once again highlight this that was being seen in the entire region and that we had been feeling. I want to take up a topic about the vaccination here in Argentina, but also in several countries in the same region. We see that you have to get a positive diagnosis to enter within vulnerable groups. Some things that we had already resolved, once again, they are on the table. And this answer has to be comprehensive. Talk about comprehensive in a health system. And we know, of course, all of us who are here, it doesn't have to do also only with dispensing medication, but the programs unify the response in the programs. It's incredible that after 40 years of HIV, we still don't know about reproductive health with the HIV programs, for example. This is just an example. So I think that it's the health systems are very fragile, and we have to focus on that and talk about that, because it's not going to work, that response, if it's not articulated, if there are no resources or joint policies between the civil societies and the programs. Thank you very much, Marcela. Lucy, go ahead. Well, the great challenge for us is still the regulation of our work. If they don't see us as people as persons who have rights, the public policies are not made up for sex workers. We need a law for sex workers and urgently review those things that are trampling on our human rights, and to stop think that we are a vehicle of transmission and not that we are women who have rights. And I think it's time for the states, the entire society, realize that we are women who were not asking to be recognized or approve them, for them to approve us. Simply respect and honor our decision to work as sex workers. Thank you very much, Lucy. You have to activate your microphone. Quickly, I wanted to mention, because I've already talked a lot, so I would prefer my partners, colleagues to be able to answer. We don't have to underestimate the COVID crisis has proven that it's a matter of class and access to resources, access to many things. There was a speech in the media about telemedicine, children who went to class on their computers at home, telework. That is a minority. That is a minority in Argentina, from Argentina to Mexico. This is an area with most inequity. So talk about teleeducation or remote working or schooling or whatever is for a minority. All of us who are we don't have to feel guilty for all that, but we have to remember the first lesson learned doesn't have to do anything to do with HIV. The state, as Lucy said, a lot of workers who were fired unskilled, and a lot of that is double vulnerability. And also, the abolitionists have taken advantage of this to tell to speak into the ears of the minister not to go and do something to provide subsidies to sex workers because it would be a precedent post-pandemic. And so this is a cross-sectional issue, and we have to be able to achieve 95, 25 in 4.5 years. We have to achieve our goals, and that is very difficult, a lot more difficult than a vaccine for HIV. And as you say, it's the cost of opportunity. Once the pandemic is over, because sometimes we talk in a past tense, and we're in the middle of that pandemic, but maybe we'll have a bit of vacation because of the heat and vaccination. But we see that in the north, the second, third, and fifth wave are on there. And so what we have lost as far as prevention, treatment, people who have died due to complications related to AIDS, and again, to recognize and charge the governments for the importance when the health system, public health system failed, the community centers were the ones who responded, and it includes the community service. And so now we have an opportunity to say, to charge them, say, hey, you need to invest in these community services. Thank you. Thank you very much, Javier. Yes, in the pandemic in certain countries has removed this strengthening of community services, sustainability, hiring with the state, etc. But the public is addressing the other side of the coin. Why leave this in the hands of the civil societies? It's a burden, but we should demand from the state itself. So request or recommend from the states. I would change that verb as tell the states to comply with their responsibility. So it's these civil society are not overburdened about social protection. Lucy, you now. We agree. We have to demand all our governments throughout Latin America to comply with us, everything that they owe us. But unfortunately, at least I can talk about Paraguay. We have a state that is doubly hypocritical with a moral change that is huge, and we are not recognized as people who have rights, and not only sex workers, but the entire population. Imagine that Javier was mentioning vaccination. If you think of workers and how we are exposed, they should think that we are a highly vulnerable population to transmit COVID. They didn't even take that into account. So if we hadn't been on the corners, in the street, to look out for our colleagues, nobody would have done it. I think that they do have a commitment and a responsibility towards us. But unfortunately, we have a state that's empty, void, double moral standards, and that don't acknowledge us, and they prefer to keep us invisible, and we cannot give up. We have to keep trying to make our governments see that this population exists and that they have needs, emerging needs. And I remember that the Amnesty International, Lucida, were calling on governments to attend to our necessity, to our needs. Colleagues, to date, they have not done it. So the second wave, the third wave is arriving, and here we are. We're still here because there is no response. We have to continue being there and being strong. Thank you very much, Lucy. Marcela. Well, we could keep listening to the fact that COVID is an excuse for anything. No money due to COVID, no education because of COVID, no work because of COVID, and no response because of COVID. And this is what we have to do. The state must, as a human right, respond to the human beings, to health, to education, to food, all the rights that we have in each country. And I think this excuse that the states keep using is something that we have to eliminate. There's responsibility here, and it's not up to the civil society. The civil society should demand respect for our rights, not that we have to go out and deliver food because people are dying of hunger. COVID would still be amongst us, and the response should be a state that is made up of a responsible policy, a strategy, a well thought out strategy, not things that they're studying going to do, just because. A lot of countries would go respond depending what they thought of that day. There was no strategy. It wasn't set up with a public policy, well thought up, with a budget, with people, with planning. Yeah. So that's why we give better responses.
We have analyzed that strategies and surveys have to be designed jointly based on what was the situation. Apparently, this is not being understood yet. So we have to ask for this to be implemented because this will go on. You see, Argentina today, well, we have a situation. Some countries feel that COVID is over, and I still today miss so many friends who have died because of COVID. So I think we should not put our guards down. We have to demand the rights. We have to be really alert as a civil society. We have to be alert to the requests, the demands, and make sure our rights are not violated. We have our implementing campaign on violence, gender violence. How many things have happened because of COVID? But this is not something that arose because of COVID. This was among us already. So this is one of the failures of public policies. We have to request this to become a public policy, but with as a state responsibility and not as civil society. Thank you. Thank you very much, Marcela. We have 1 minute 20. And I would like to ask you if you could demand an action, request for an action in an immediate future. We have quite an array of different kind of representatives in this. What should be the immediate action we should implement to overcome these barriers set up by COVID in the region? Well, I believe that the action, I will take something from Lucida. I have to say that it's putting the voice of the civil society in the center of the response. This is something that we have heard many times, but this is not done. If we could implement public policies with the voice of civil society, with the experience, and especially with the strategies, the answer would be different. Thank you, Marce. Lucy. I fully agree with what Marcela just said. You have to adopt the strategy from the populations, all strategies that have really proven an impact through key populations, through us, through ourselves, through all the populations, not only sex workers, sexual workers, all the populations, because they are the ones that gave good results. So we have to be listened to. We have to put all the lessons learned into practice. Thank you very much, Lucy. No more time left. I want to thank you very much, Javier, Lucy, and Marcela, for your availability and for sharing your experience with you. Big hug and take care. Thank you.